some amazing presenters regarding addressing grief and loss during COVID-19. This is specifically a presentation for healthcare professionals, so we're really excited to have 4 amazing presenters to talk through stages of grief, as well as helping you with some answers to questions you may have at this time. So please save your questions and answers. You can put them in our chat throughout the time, and at the end of the presentation, our presenters will all come back on to answer your questions. So what I'm going to do now is I'm going to introduce one of the first presenters, and she's going to introduce the entire team. So I'm going to bring on Kelly. Welcome, Kelly.
Hi, everyone. So good afternoon, everyone, and welcome. We're really happy that you're here with us, and hope that throughout this presentation we can provide you with some useful coping strategies for grief and loss during what has been a difficult time during COVID-19, particularly for healthcare professionals. So I want to first introduce myself and the team of presenters that I have here with me. So I am Kelly Culp. I'm the Director of Behavioral Health Therapy at Temple Episcopal, as well as a licensed clinical social worker. I have also with me Emily Browning, who is also a licensed clinical social worker and is a palliative care manager at Temple Hospital. We have Dr. Williametta Simmons, who is Temple Episcopal's leading psychologist. She is a member of the APA. She is president of the PPA and member of the board of directors. She is also the owner of Integrative Psychological and Consulting Services in Bala-Cynwyd. And then lastly, we're joined by Tori Tuman, who is the supervisor of behavioral health services at Temple Episcopal and also a licensed social worker. So I'd like to just begin with the title of the presentation. As you can see on the title slide, we are going to be discussing addressing grief and loss during COVID-19. And this is a healthcare edition, particularly because as healthcare professionals, we have experienced extreme challenges and emotions during this pandemic. And those sorts of challenges and emotions can manifest differently for different people in many different ways. So I want to talk really just briefly about 3 sort of ways in which they can manifest, and then sort of dive a little bit deeper into the third topic. So one way our feelings can sort of manifest during this is with anxiety and burnout. So healthcare professionals already have a very high level of burnout, but during the crisis, it really has been even higher. So this can be being required to work increased hours. This can be just the work in general increasing, and then just the fact that it's scarier work. Worrying about contracting the illness or bringing it home. It can sort of manifest as a lack of feeling appreciated or recognized. And this is particularly true for nursing homes, actually. They're sort of the unsung heroes in many ways through COVID, because a lot of the times we see hospitals getting sort of these kudos and free meals and gifts and all these different things, which are very well deserved. But we're seeing that a lot less with skilled nursing facilities. And this can be frustrating, I think, for healthcare professionals in that field, because you're really facing the largest number of cases in those areas and within that population particularly. So Temple specifically wants you to know, that we certainly appreciate you and everything that you're doing, and are really grateful for you and the work that you do. And then lastly, another way that our feelings can manifest are obviously in grief and loss. This can be loss in lots of different ways. This can be loss of your own family. So maybe you are a healthcare professional and you are sleeping in, and this happened at Temple even, where people were sleeping in dorms to avoid going home and potentially transmitting the illness to their family members, or staying in hotels even. So you start to not see your family as much, and the grieves the loss of just that family bond. In addition, it could be loss of a patient. To say it simply, patients that die from COVID. It's difficult enough to watch any patient die for any reason, but this was such a fast-moving illness that we may have been dealing with it more than we were used to. And I think it's important to remember for healthcare professionals, a lot of the patients that we serve, we're serving for long periods of time. So they almost become like family to us. And we, during COVID and a lot of the restrictions, have become their only family. So there's a lot of grief and loss sort of there. And then also just the loss of our own ways of life, just normalcy. Everything is changing. There's a lot of uncertainty, and we have to learn how to provide treatment differently, work differently together, and learn healthy ways that we can cope to combat sort of some of the feelings, particularly with grief. And that's really where we're going to dive in a little bit deeper during this presentation. And I'm going to actually turn it over to Emily, who is going to give a little bit more background on grief and loss. We're going to look at how we can tell when we're experiencing it, how providers may grieve differently, and then also some ways that we can successfully and in a healthy way cope. So, Emily?
Thank you, Kelly. So, this may seem like kind of a crazy question to start out with. How can you tell if you're experiencing grief? But I'll tell you, I think this has actually gotten more complicated in recent months. I know when COVID-19 first hit the United States and we were all trying to figure out how it was going to impact us, and people had to start self-isolating, and we all had these new procedures to start. I don't know about you guys. I mean, I think we all have had our own experience of how we've gone through this, but I felt really anxious. I felt really sad. I just felt really weird, like what's going to happen? What's going on with my life and everybody else's life? And it actually took me a while to hone in on, I think that some of what I am experiencing and what we are collectively experiencing is grief. So let's talk a little bit about some ways that we recognize grief. Next slide. At its most basic level, grief is really the normal process of reacting to a loss. I think we all know that on some level, but I'm not sure we recognized really early on, most of us, that some of what we were responding to in this new COVID world was a whole lot of loss. For some of us, that loss might have been a death. Might have been an early death of a family member or a patient or somebody close to us, but not for everybody was the first loss about that. Some people lost jobs. Some people, as Kelly said, lost connection with family. Some people lost even, a great vacation you were supposed to go on the first week of April, and it couldn't happen because of COVID. All of those things are maybe different levels of loss, but they are all loss. And any loss can lead us to some of the experiences that we define as grief. We see here, I think you can see most of my picture of a roller coaster. And I put this up because as I work with patients and families who are experiencing grief and loss, I very often describe grief as a roller coaster. And I think this is because for so many of us, grief comes to us as this experience of ups and downs, where we're just not really sure how to manage. One day we feel okay, one day we feel terrible, and we never know when we wake up in the morning what kind of day it's going to be. It's really exhausting to go through grief, I think, because of all of those unpredictable ups and downs. But that's actually a really normal part of the experience of grief, as abnormal as it feels on the inside when we're going through it. And those highs and lows depend on so many things. The kind of relationship, if it's a person who died, the kind of relationship you had with them, obviously if you were much closer with them, if you knew them for a much longer time, if you're closer to them at the time of their death, all of those things are going to impact how it affects you and how you cope. If you have many losses in succession, that can really build up on you and make the experience of grief even harder. So my heart goes out to some of the families you may have seen in the news or even taken care of some of these patients whose families have lost multiple family members. That really adds to grief when it's loss on top of loss. So all of these things play into how you're going to experience grief as we're going through it. We all can go through emotions in different ways. So on the next slide, thank you, you'll see another way I like to describe the experience of grief that seems to resonate with people is as a wave, and not just one wave, but sometimes many waves. So as we go through different kinds of loss, our first reaction might be just to feel really numb and really shocked. Like at first, if you see somebody who's had a big loss and they're not crying, they don't seem that sad, and you think, what's going on with this person? Like, don't they even realize what's happened? Don't they feel sad? That person might be in that initial stage of not even being able to take in yet the magnitude of what's happened. I kind of felt this way again when this COVID era first started in Pennsylvania, where I think we were just all in this state of shock for a while. We just walked around feeling really, really strange, like we didn't know what to do. And I think it's because we started off in this phase of just not really comprehending what was going on. Many people describe that sort of like that roller coaster feeling, that grief comes in these waves that sometimes are really huge and feel like they want to just knock us down and lay us flat. And sometimes they're much, much smaller. But again, they're unpredictable. We don't always know when one of these waves is going to hit us, which again, can be very, very tiring. Many people find when they're going through grief that they have a lot of trouble concentrating, even if they're trying really hard, and may feel frustrated with themselves. You may have felt this way some over the last couple of months. I really want to get this thing done. Why can't I get it done? Maybe you found you were getting enough sleep, but still felt really, really exhausted. Or the opposite experience. Some people find that they used to sleep okay, and now they can't sleep at all. Feelings of guilt are very common. I think for COVID, this has been especially complicated because we may feel guilty on a number of different levels. If I feel like I brought COVID back to my house and somebody that I loved got sick, maybe I feel guilty about that. Maybe I feel guilty for something that I really had no control over, but that's just how I feel. Which can be very distancing from other people and cause you to feel really isolated or feel like nobody understands what I'm going through, even feel angry at other people who aren't going through grief right now or envious of the relationships they still have that are intact. So all of these feelings are very, very normal when we're in a context where grief is all around us. So we're going to talk a little bit about when we see our patients and our patients' families going through grief, how can we help them? Because we really can feel very helpless, but I think there are some things we can know and some tools we can use that may help us. I think the biggest thing to know is that you can't fix it. You can't fix grief, and it's okay. I think as healthcare workers, we so much want to fix things. I know I do. I struggle with this a lot. I'm a social worker. I want to try to make things better for people. We can be there for people. We can support them. We can let them know we're supporting them. And that is all very, very important. I don't minimize that at all. But we cannot take away the grief they're feeling. They actually need to experience that just as we need to experience it when we're going through it. So we can certainly empathize with people and let them know that we care about them, that we're thinking about them. We can make sure that we support their mourning rituals, whatever those things are. So in the past, that's been a funeral. Now that's a lot harder, although we're finding some virtual ways to connect there. Maybe it's at the time of a death, something that a family needs their family member to hear or know, a piece of music that they need played. Those are all rituals that help us in our times of grief. This is not the same process for everyone. So we can't assume that, because this patient or family really needed this thing when they were going through loss, this other person is really going to need that. We can learn from our experiences and get better at supporting other people, try to anticipate some of the things they may need. But we also always have to recognize that this feels and looks different for everybody, and make sure that we're not judging other people for how they're going through their own time of loss, and know when we should advise them that maybe they need some professional help, that maybe they really are starting to get depressed or coping in a way that's not healthy, and we can help connect them with someone else who can help. So one of the things that you can look for in thinking about whether somebody may be feeling depressed, and one thing that gets very complicated is you can be depressed on top of having grief. So there is certainly a normal experience of grief, that is not depression. And there's depression that's not connected to grief. But if somebody is already grieving, they can have depression on top of that. So it can be take a little bit of time to sort out, is this more grief that I'm seeing or more depression that I'm seeing? If you notice that somebody, especially after a significant period of time, like months after a loss, is really deeply struggling still every day, you can look for some of these signs. So I think that a couple of the helpful things to think about are that when somebody is depressed, their mood is almost constantly negative and low. Whereas in grief, we talked about those waves, where sometimes people may feel really low, but then at other times they're doing okay. In depression, you tend not to see the waves so much. You tend to see more persistent negative mood. You may also notice that somebody's self-esteem really seems to have taken a hit. They're really down on themselves. Like, oh my gosh, I'm a terrible person. I can't do anything. Nothing ever goes right. People who are feeling very, very guilty, especially over something that may not make a whole lot of sense in our minds to feel guilty about. Those can be signs that in addition to grief, somebody is also experiencing depression, and again, may need to get more help for that or a different kind of help for that. Because we think about 1 in 5 people going through grief will also experience major depression. It is important to look out for this, especially for people who have also other big life stressors and may be at higher risk for becoming depressed. But when you want to help somebody else who's grieving, there are some things that can be more helpful to say and some things that don't seem as helpful to say. So on the next slide, you'll see that even though there's no one perfect thing to say that will work for everybody, we can at least have some guidelines to go by. Some of the things we can feel really tempted to say are things like, I know exactly how you feel. The exact same thing happened to me. When this thing happened to me last year, that's exactly how I felt. But I would advise us to be really careful about saying things like that, because a lot of times a person in grief can actually feel like that is minimizing their experience, may feel like, no, you really can't understand exactly what I'm going through. Obviously, it depends on your relationship with that person, but I usually just caution us maybe to say something more like, you know what, I only can just start to imagine what you're going through. I know I have been through times where I was really sad. You seem really sad right now. Can you tell me a little bit about, what is this like for you? Because I really want to understand and I really want to be there for you. Sometimes we don't know what to say, and it's okay to say, I don't even know what to say right now. Like, this pain is so deep for you. Again, I want to be there for you, and I'm sorry that I don't know what to say. And I think that most people appreciate that. Also, be really careful of saying things like a person is in a better place. Some people believe that, and some people don't. And even people who believe it don't always find it really helpful when they are in that very acute place of thinking, that's great if she's in a better place, but that doesn't help me feel better right now. Like, I'm still really, really sad that she's not here with me. So again, I think we just have to be acknowledge that people are going through a loss, acknowledge that they're struggling, let them know that we are there for them. And we can ask them, is there something I can do for you? Or I think you almost never can go wrong. You send somebody a note, you bring somebody a flower, and say, I know you're going through a lot right now, and I just want you to know I'm there for you. I love this, the cartoon that's on the next slide, this care and feeding of your grieving person. It really goes along with the previous slide about how to help somebody else in grief. I just think it's a great reminder that everybody may need something a little bit different when they're grieving. We're not asking anybody to be perfect. None of us are ever going to understand somebody else's experience perfectly or always say or do the right thing. I think if we approach this with hearts of compassion and humility, we will always be able to make some kind of difference. If we're awkward sometimes, it's okay. You know, nobody is always going to say the right thing, but I think most people appreciate that we're trying. And whether that's just being with a person as well as we can, you know, in these times of ongoing social distancing, I know it can be really rough unless we're tasked with actually taking care of somebody and have to be there with them all the time. But asking somebody just a simple question, you know, tell me if it's somebody who lost their mother, you know, tell me more about your mom. She seems like she was a really special person. You know, is there something you can tell me that helps me understand more, you know, who she was and what was so special about her. And again, I think sending notes, bringing a flower, asking how you can help are all ways that we show people that we want to help them and that we're acknowledging their loss. I think ignoring somebody else's experience of loss, our hearts are in the right place a lot of times. I think we think that we are helping somebody, but really they may not feel acknowledged by us. So when we are the ones grieving, we have to take care of ourselves so that we can help take care of somebody else. You know, there's a place for putting on our own oxygen mask. So when we're the ones grieving, not only are we going through all that stuff I just described that everybody goes through, we've got some specific things to think about. So we as healthcare providers may even grieve a little bit differently from people who are not in healthcare because we know death all the time. It's so much more a part of our daily life than it is for most people. So I think we can sometimes have a deeper understanding, but also those losses can build up on us more than they do for other people. We get that life is not forever. We get that loss can happen quickly. It can inoculate us a little bit to the experience of going through loss, but I think it can also make us more sensitive to it. We may hide our emotions more because we think, I've got to take care of somebody else. I can't, you know, go crying all over the place while I've got all these people to take care of. And that can really hurt us when we don't share the ways that we are grieving. So we have to be really careful of that as providers, that we are taking care of ourselves, because we know this, that if we don't take care of ourselves, we can't help take care of somebody else. So in just a moment, I'm going to turn it back over to talk a little bit more about what we do when we're the ones who are grieving, and we need to figure out our own coping strategies for how are we going to go through that. I like this little cartoon just because, you know, we talk a lot about the stages of grief. You may have heard of Elizabeth Kubler-Ross and her original stages of denial, anger, bargaining, depression, acceptance. And I think sometimes we think, oh, well, I'm just going to take this exit and then I'll be all done with my grief. You know, I'm in acceptance now, I'm fine. But remember that grief hits you in those waves. So it's not always just a process of, I'm going to take this exit and be all done with my grief. We have to keep on working through it. So I'll turn over now to talk more about coping.
Thanks, Emily. I think you did a really great job explaining grief and how it affects people differently. The biggest thing, as we all know, is that grief hits people in waves and people react to grief differently. Grief manifests differently. And people, you know, some people get angry, some people get upset, some people get isolative. And it's okay to be overwhelmed with all these different emotions and all these different experiences that are going on. It's okay to yell, to cry, you know, to sit down and just take a break. A doctor that I used to work with for a long time would always say that, you know, when you cry, that your tears are your well of love that you had for that person or that particular event that you lost. And it's okay to let those tears out and kind of let that well overflow. It's also important to get adequate support. So whether that's in your personal life, your professional life, you know, let people know how they can help you and maybe let them know what will not be helpful. Everyone is trying to do the best with what they have. And people are going to make mistakes and not know what to do. The next thing is to practice personal awareness. So being attentive to your personal needs, acknowledging your feelings of grief and loss. Don't try to suppress them. Don't try to deny that they're happening, and don't try to turn the other way. It's important to actively pursue healthy coping strategies. So one of the things I've done for many, many years, it actually started when I used to intern at Temple. I interned on the trauma unit, and you're taking home a lot of grief, a lot of loss, a lot of changes. And I would pick this particular traffic light. And when I got to this light on Broad Street, I would just kind of blink and that would be it. And I would leave all the heavy and the bad stuff, behind me on that traffic light. And then I would move forward with my day and go about my life. And that's something that I've done in practice throughout my various jobs and my careers. And it's something that's really helped me and kind of grounded me dealing with these very difficult situations and this range of emotions. The last thing is to set boundaries. So that's with people, and now in this time with social media and the news. So, a lot of people may have reached out to you. They know you work in healthcare. They know that you're going through something. And it may seem like everyone just wants to talk to you all the time about COVID and your experience. And it's been really important for me to kind of set boundaries. So when my family reaches out or my friends reach out, I want to talk about it for 5 or 10 minutes. I say that up front, not trying to be rude or insincere by any means, but just setting those boundaries that this is what I need to do for me to take care of myself. The same thing with social media and the news. So try to limit yourself to what you're taking in. There's so much going on in the world. There's so much going on in 2020, and we're just inundated every single day, all day, from various angles. So set a time limit on how long you're on Instagram or how long you're watching the news, and pick 1 or 2 trusted sources you get your news from and your information from. Don't overwhelm yourself, because there's always going to be something new and there's always something that's going to be going on. So in the next slide, we talk about practicing self-care. It's really important during this time, especially with all the restrictions and the limitations, that we remain active, both mentally and physically. I think people, when you hear active, you automatically think of physical activity, whether it's running, taking a walk, sitting outside, taking a workout class online, dancing. All those things are getting easier, as the weather is getting warmer. And I think people also often forget about staying mentally active. So now the nice thing about technology is it's so easy to access different meditation apps. I mean, there's just so many out there, Headspace, Calm. I use ClassPass. They have a whole section of self-care now. There's just so many different tools at your fingertips to do a quick meditation, a quick mindfulness relaxation exercise. And that'll keep you engaged. Also, some people, they deal with grief and loss through writing, whether it's writing a song, writing a poem, writing in a journal so they can look back a year from now and kind of remember things. So it's important to kind of stay creative and figure out what works for you. What works for me is not going to work for other people. And it's about just taking the time to explore these different outlets and see what will help you. Another thing that's been really popular in the last couple of years are stress reduction games and, these adult coloring books and activities. And if you're like me, you've been ordering a lot of things online to help you cope, online shopping, and all those things come with bubble wrap. So one of the things that I do is if I'm stressed, I'll take the bubble wrap and pop it. And it seems silly, but it's something that's very helpful and very effective. I already touched on writing out your thoughts and feelings, but that's something it's easy to do, even if it's just writing a little list or a little paragraph before you go to sleep. That way, the thoughts are leaving your brain and you can think peacefully. So now I'm going to turn it over to Dr. Simmons, who's going to continue talking about how to cope with loss and grief.
Thank you so much, Tori. That was wonderful. I am going to continue with self-care, and Tori did a good job laying the foundation, and we'll just continue sharing some things that's absolutely important when dealing with grief and loss. All right, so one of the things we have highlighted here is to eat nutritious meal. In other words, eating healthy. We all know the benefits of eating healthy, the fact that it improves our mood, it affects our energy levels, it affects our concentration levels. And there was actually a study in 2016 that showed that high glycemic food, meaning soft drinks, soda, cakes, white bread, biscuits, really increases your symptoms of depression and increases fatigue. So that tells you how much food is really important. So eat healthy. As healthcare providers, sometimes we're so busy caring for other people that we forget to care for ourselves. We may just eat whatever's around and not necessarily take the precautions or the step to eat a healthy meal. But this is absolutely critical during this time. The next thing I want to mention is sleep. Sleep, again, is another important piece of a healthy lifestyle, of taking care of ourselves. Sleep is actually one of my favorite hobbies. However, when we're worried, and I know for me, especially during this time, I found myself having to make myself sleep because I'm staying up and I'm reading and I'm thinking a lot. So really just make sure that you sleep, because sleep affects your mood. Decreased sleep often leads to increased irritability, concentration, attention, and we make a lot more mistakes. Again, as healthcare providers, we are noting in patients' charts, we're doing different things. We make a lot more mistakes when we are sleep deprived. So it's really important that we get enough sleep there. The other piece that I want to highlight is avoid using alcohol and drugs as a way of coping. I have found that during this time, I don't know if you saw that on the news, but a lot of individuals actually turn to alcohol as a way of kind of coping with COVID-19. What I am saying here, and why I think it's important for us not to use alcohol and drug as a way of cope, is because when we use illicit drugs to cope, what we're doing is we're numbing our feelings. And these are feelings that need to be expressed, and these are feelings that need to be addressed. So it's important that we don't just use those drugs to cope. All right. Next, give yourself time out from the pain. What I mean by this is try to do something you enjoy, deliberately doing something you enjoy. It may be playing music, playing a piano or a flute, or taking ballet lessons, or something that you haven't done before. I am an adrenaline junkie, so what I would probably say here is maybe it's skydiving or maybe it's bungee jumping, but really doing something that will give you a time out from the pain. All right. Now, on the next slide, we're going to talk a little bit about other things that you can do. Next, incorporate humor. All right. Oftentimes, people associate working at a hospital or hospice, dealing with palliative care, or nursing homes. They usually associate that with sadness, depression, and death. Hardly ever do we, especially if you work in a nursing home, if you tell someone I work in a nursing home, hardly ever will they say, oh, you must be having a lot of fun. Oftentimes we're met with things like, oh, I couldn't do that, and just this sad countenance. But the reality is there's a lot of humor that can take place in a nursing home. And in fact, I'd like to say that, if humor is a part of our living experience, then why shouldn't it be a part of our dying experience? All right. There was a study actually that in the American Journal of Hospice and Palliative Care that found that humor was present in 85% of 132 observed nurse-based visits. And what was really even more exciting is that 70% of that humor was initiated by the patient. So we see here that humor is active, even in a nursing home setting, even in hospice and in palliative care. It is something that truly can be a part of both our living and our dying experience. All right. And again, as providers, there's nothing wrong with laughing every now and then, even if we're hurting. There's a lot here that we know about laughter. And so I'll just highlight a few things about laughter. We know that laughter reduces our stress. It strengthens our immune system. It improves our alertness. It increases our endorphins level. It also lowers our blood pressure, and it helps with suppressing pain. So again, laughter is good for the soul, and it's all captured here in all that I've highlighted. Another thing to do in terms of coping with grief and loss is to find a way to say goodbye. All right. This could include ceremonies or rituals that's kind of related to the person or even the place that you've lost. All right. Ceremonies could be things such as funerals, wake, and right now, because it's COVID-19, some people are doing kind of drive-through funerals or drive-through experiences or even virtual experiences where you're celebrating the person's life as well as their death. Some other ways to celebrate is using floating lanterns or balloons or, and just letting it go in the air just as a way of commemorating the loss of that person. Other ways to grief and loss is really to grieve and to lose health, to cope with grief and loss, I'm sorry, is to truly engage in things such as writing letters or poems or songs. Again, those are all really wonderful ways to say goodbye and get some of our thoughts out of our heads and onto paper. All right. The other thing that I especially love about saying goodbye is just storytelling. This involves maybe spending some time with your loved ones, friends, and family, and sharing that grief experience. Also, sharing your favorite memories of the individual or individuals, lessons learned. I recently worked with a patient who lost his mother. And one of the things that he stated was, my mom had life lessons that she taught us. And as part of commemorating her, I included her life lessons into the programming for her death. And we talked about ways that those life lessons could be made to come alive even in this young man's experience and in his life. So one of the things that he did, he's very creative, he's an artist. He took each of those life lessons and created an artwork and a project of sort and have them in different areas of his house so that he can remember his loved one every time that he sees these different life lessons. So these are ways that you can truly grieve and cope with grief and loss. All right. So again, favorite memories, life lessons. And then the other thing is sometimes when it comes to grieving is what do we, as part of saying goodbye, working out what to do with the person's physical memories, right? Some people prefer to get rid of everything. Other people prefer to pass it down to different family members. And then some people hang on to it. Whatever you do, just, I would say that you want to ensure that is a part of your healing process. There are individuals that would want to completely get rid of everything. Typically, what I have found is you might want to store it somewhere or give it to someone to hold until you feel strong enough to deal with kind of incorporating that into your new life. The next thing is meaning making. Meaning making has to do with really just, it's about finding a way to sustain your love for that person and to sustain it even long after their death. All right. And it's doing so while you're still moving forward with your own life. And this is really David Kessler. If you want to read a good book about meaning making, check out The Sixth Sense of Grief by David Kessler. He really talks about meaning making in this way. All right. So ultimately, when we talk about meaning making, we're talking about reconstructing your life in such a way that you can move forward, but still maintaining that person in your heart and in the way that you live. All right. So when we think about grief and loss, I love this right here because it says loss is actually what happens in your life, but meaning is what you make happen. So I think that's a great way to think about it. Here's a good example of meaning making. Eamon Cohen, she co-founded Families for Safe Streets. And the reason why she co-founded this organization was because it was after she lost her son, her 12-year-old son, who was killed by a car in front of his own house. She co-founded this as a way of combating dangerous conditions and reckless driving in the streets of New York. And this is basically a really great example because it's taking that grief and that loss and really transforming it into something that's meaningful and that can always live on as a way of keeping the person's memory and doing something about that loss, right? The next thing is allowing yourself to heal. Healing doesn't mean forgetting the person permanently or letting go of that person. Ultimately, healing simply means finding a way to live a healthy life, even in the absence of that person. I have found often in my practice that sometimes we feel so guilty for forgetting someone, or even for a short period of time, or beginning to move on with our lives. And the reality is, it is truly a normal part of healing. So if you find that, oh, I used to think of this person every single day for every hour, and it's been a whole day I didn't think of them, please don't feel guilty about that. Recognize that it is truly a part of the healing process. All right. So ultimately, what we're doing is taking it one day at a time, one moment at a time, and really just finding a way to get through this process. Finally, believe that you can come through this. What I mean by this is, listen, the truth is, you won't completely be the same person. But that's okay. You are going to be able to still survive this major loss and this part of your journey, because you've pretty much equipped yourself with the necessary resources to do so. Again, it's about taking it one moment at a time, one step at a time, one day at a time, and recognizing that there will in fact be setbacks, but know that it's truly just a part of life's journey. And again, just be patient with yourself, understand that it takes time, and just breathe through the process and lean into it, as challenging as it can be. Next. All right, so I love this. This is a wonderful quote that's provided here by Bernard Siegel. And what he said, this is for healthcare providers in particular: please don't cry in empty rooms, stairwells, or locker rooms. Cry in public and let your patients and staff heal you and see that you are human. I think that oftentimes as healthcare professionals, we have this misconception that we can't cry in front of our patients, or that we're ought to be superhuman, superwoman, superman in some way. But the reality is, we are in fact human, and there will come a time where we have to grieve, and it's okay to cry publicly. It's okay to allow ourselves to let it out. Next slide, please. And I want to just leave you with this quote. This is from All of Us, from Robert Frost. And I think it's just a beautiful way of conceptualizing grief and loss. It says that hope is not found in a way out, but a way through. And I think that that is absolutely true, because a lot of times when we're grieving, I know for me, I often think, if there was only a way that I could just wake up and be on the other side of this grief, it would be wonderful. But the reality is, as it was stated earlier, that we go through grief waves, right? And that there will be times where we feel okay, and then times where we feel sad. And grieving isn't necessarily about a way out, but rather it's about a way through. All right. So that pretty much completes the bulk of our presentation. Here we just have a few reading on grief that are wonderful. Again, dying well, the 4 things that matter, rules of inheritance. You can read it out here. And then the other slide really just includes some resources for grief and loss. So these are direct links that you can go to really get a more resources and in-depth explanations, or some answers that you may have concerning grief and loss. I hope. Oh, and there's a final slide here that really looks at some COVID-19. There are COVID-19 resources. All right. So I hope that they are helpful for you. And again, on behalf of our entire team, Tori, Kelly, Emily, and myself, I really thank you for joining us. And if you have any questions, feel free to type it in, and we'll be glad to answer those questions for you. Thank you so much. Hi, Kelly. There's our panel. All right.
I don't see any questions coming in, but let's just give it another minute or so and just make sure nothing pops up. And our contact information as well should be in this presentation, so you can also feel free to reach out to any one of us via email. With if you want any additional information, do not be shy to reach out. We're very accessible and very easy to talk to. So
And we can also send out the presentation if you're interested as well.
Exactly.
Wonderful. Do you want to add that the information will also be added to the YouTube right underneath the link? That'll be added there, so you can absolutely get it there as well. I think one of the things, for what it's worth, if we went back into coping, something that we meant to mention concerning coping and kind of meditative practices is just that sometimes praying is also an important part of people's coping. So that's something to incorporate as well.
I see we got one thumbs up.
Oh, well, that's good.
Great.
All right, so I just wanted to say thank you to everyone, to all the presenters. I apologize, I have to pop Kelly back off, but she'll be back on again. But thank you all for this wonderful presentation, and thank you all for viewing it today. It will be available for you to watch afterwards, or if you'd like to share with anybody, please do. And as Dr. Smith mentioned, I will also have the information in the YouTube description of the presentation. So if you would like some information about the links and the great information that was presented today, please take a look at that. Thank you again to all the presenters, and if you have any questions, please reach out to those individuals. Thank you.